Hello everyone, welcome back to my channel. I'm Nix. With all that ruckus last week with regards to whether or not illegal, undocumented foreigners should receive free healthcare in South Africa, the South African Human Rights Council getting involved, there's a lot to say about it, but who pays the price of that free medical? The taxpayer. So today I thought, what would be nice? Let me take you through the provincial health department's spend. And I'm actually going to show you how much these employees get paid, as well as how much they spend on everything else, a portion of which is theft. So stick with me on that. I think what's important though, let's first go through some of the news and comments and opinions that you can find on X if you search health department. So let's start there, just to give you a bit of context in terms of how everyone feels about the health department. And from there, I'm going to take you through a couple of numbers. But let me tell you, big surprise, I've made them all into pie charts. So super graphic, nothing numerical. Don't run away. Stick with me. I've got stuff to show you. Okay, so like I said, this is a search on X, Department of Health. 3 hours ago, corruption in the KZN Department of Health is far deep than all other departments. Here we have Eastern Cape Department of Health. The Department of Health is in a crisis, but even with limited resources, we must value every role, not just doctors and nurses, but non-clinical staff, cleaners, porters, admin staff. We are one team. No one is more important than another. Listen, MEC in action. You need to look at your spend before you start talking about we are one team, this wellness stuff. You've got bigger fish to fry. So we reject the hypocritical outrage from a collapsing health department that can't even resource its own citizens. When we're done at the gates, we're coming inside for the foreign doctors you've prioritized, while thousands of qualified South African doctors sit at home jobless. This comment is in response to SABC News saying the Department of Health has condemned the actions of groups blocking access to healthcare facilities to deny treatment to patients who are undocumented foreign nationals. The word undocumented kind of says it all. I mean, why do we even have to go past that word? You're undocumented. You don't even have a tax number, so you're definitely not contributing to any of these health departments. The Department of Health is usually silent when South African women give birth on floors because they have no beds. And people die because they can't see doctors. I'm shocked they even know how to write statements. Again, on that one, they also want illegal foreigners to get free medical treatment, knowing exactly there are shortages of doctors and nurses, which, by the way, has been a persistent issue year on year on year. Like, at what point do we start resolving the problems the ANC caused 30 years ago and start moving forward as a society? When does that happen? But you know what? South Africa's government is running in circles. They honestly don't know how to do their jobs. So why is the health department allowing the world to see the wrong pictures as if they care about foreigners at the expense of others? Oh, KwaZulu-Natal Department of Health is hiring, guys. Just so you know. I wonder if there's BEE principles there. Some of these are international. We patriotic South Africans condemn the Department of Health, which exists solely based upon the hard work of South African taxpayers. Ta-da! Whoever sent that condemnation can go jump an electric fence on a rainy day. Last one. But that's the very department that cannot hire more health workers, a number of South African citizens waiting for cancer treatment, operations and poor health care facilities. Yet they worried about illegal foreigners getting free health care. So that's the recent news about the Department of Health. The government only need open X, search for their own department, and read the posts and comments underneath to understand the sentiment of South Africa towards the ANC specifically, or that's who I'm talking about anyway. So we don't really need a national dialogue. The national dialogue's happening on X. So like X the national dialogue. Anyway, let me not get side noted on that. I quickly want to show you how this money gets spent. Eastern Cape Health Department spending almost 70% of their expenditure on employee costs. They only spend 31.5% on everything else. So that includes maintenance of buildings, purchasing of assets, etc. Unfortunately, 4% of that is considered irregular, wasteful, and fruitless. AKA, the government doesn't follow their own processes and procedures. And that cost sits at 321 million. KwaZulu-Natal Health Department, it's one of the posts I read for you, spending 64% of their budget on employees and only 35.7% on everything else, of which almost a quarter is irregular, wasteful, and fruitless, which sits at a grand total of 4.3 billion rand. That is for a provincial health department. Free State Health Department spending 68.8% on employee costs, with 31.2% going to everything else. Surprisingly, I'm not going to lie, their irregular, wasteless, wasteful and fruitless spend is only 0.7% at a very tiny amount of 28 million. I don't know, but it is what it is. So kudos to them. So Northern Cape Health Department has 55% for their employees, 44% for goods and services. But their irregular, wasteful and fruitless spend exceeds their goods and services budget by 31%. Mpumalanga Health, 61.1% on employees, 38.9% on everything else, of which 4% goes to irregular, wasteful and fruitless spend. Gauteng Health, 62% goes towards employees, 38% towards goods and services, of which 12% is irregular. That bill, by the way, is 2.6 billion. Northwest, 66.4% for employees, with a 33.6% for everything else, of which 13% goes towards not following procedures and processes. That bill is 671 million. Limpopo Health, 66% goes towards employee costs, 34% to everything else, of which 17% is irregular, wasteful and fruitless. I always leave Western Cape until last because, I mean, this is an example that it is possible. Western Cape Health Department, 58% employee costs. Bear in mind that a lot of these employee costs are managed by unions. 42% goes to goods and services, and only 0.06% is irregular, wasteful, and fruitless, at a total of 6.8 million. So it really is possible. These are the numbers for just the Department of Health per province, 9 provinces in total. Every week I'm going to create a video showcasing these numbers for a new department per province, because I want this to be the information we use when we go to the provincial elections next year. These graphs show you where your tax is going. We are basically just paying for employees. Their output, however, is zero. That's the problem. I don't mind paying you 66% of every R1 I give you, but am I receiving any sort of value back? No, I'm not. So there's the problem. If you guys have any other ways on how I can display this data, making it a bit easier for you to consume, then please drop a comment. I'm more than happy to switch it up. I hope you found this video insightful and useful. If you did, don't forget to like and share. If you're new and this was enjoyable or shocking, horrifying, make sure to subscribe. And other than that, I really think I'm done. I hope you guys have a great week. Over and out.